Now we have to see that which antihypertensive would be the best suitable for this lady. Okay. So what are her current medications? Okay, so all the pregnant women, so they must take folic acid. Okay, so they must take folic acid, and also they must take the iron supplement. Yeah, she's physically fit, so she doesn't have any other problems. So the only concern is her blood pressure. Okay, so she has uncontrolled blood pressure, for which the doctors, they started her on methyldopa. Okay, and now after starting methyldopa, she started a sample case through which you will come to know that how you have to prepare for this examination. So here, RR, a 26-year-old pregnant woman with hypertension, was started on methyldopa for blood pressure control. Okay, so you see the condition here. They are saying that she's 26-year-old female, that too pregnant lady. Okay, so she's pregnant and she has hypertension problem. Okay, but that the doctors, they have started her on methyldopa. And 6 months after starting the methyldopa, okay, her Coombs test turned positive, okay, indicating that there is a risk of methyldopa-induced hemolytic anemia. Okay. Now, what is this Coombs test? So for the patients, when they start on methyldopa, okay, so they perform the Coombs test, and this Coombs test, if it turns positive, it indicates that there are antibodies that have developed. Okay, so what are those antibodies? The antibodies that mainly attack our own RBC cells. Okay, so one of the common side effect of the methyldopa is hemolytic anemia. It causes the lysis of our own RBC cells. It causes the death of our own RBC cells. Okay, so that's why before starting methyldopa, we need to perform the Coombs test, and after starting the methyldopa, again we have to perform the Coombs test. Okay, so that's what they did. So after 6 months, they have performed the Coombs test, and that Coombs test was positive. It means that now the antibodies have developed in her blood, and these antibodies will destroy her RBC cells. It will cause the lysis or the death of the RBC cells. Okay, so that condition, we'll tell it as a hemolytic anemia. Okay, so now as the antibodies are positive or the Coombs test is positive, the doctors have decided to stop immediately methyldopa. We can't continue methyldopa. If we continue methyldopa, then she will end up with hemolytic anemia. So we can't continue methyldopa to her. Okay. So now the doctors, they have decided to stop methyldopa. Okay. And as a pharmacist, we have to recommend an alternate antihypertensive medication for this patient. Okay. So this is the scenario, guys. Okay. So this is the scenario. 26-year-old lady, pregnant woman, hypertension. Okay. They have started methyldopa. And after starting methyldopa, the Coombs test is positive, means she is prone for hemolytic anemia. So the doctors now, they have decided to change to another alternate antihypertensive drug. Okay, so now we have to see that which antihypertensive would be the best suitable for this lady. Okay, so what are her current medications? Okay, so when we look at the history and when we look at the medications, okay, her medical condition as well as the medications. Okay, so currently she doesn't have any other medical conditions. Okay, the only problem is hypertension. She's pregnant woman with hypertension, no other medical conditions. Okay, so now what are her current medications? Her current medications are, she takes methyldopa tablet, 250 milligram BD, that is twice daily for her hypertension. And she's on folic acid supplement, okay, 0.5 milligram daily. So why folic acid? Because all the pregnant women, okay, so all the pregnant women, so they must take folic acid, okay, so they must take folic acid, and also they must take the iron supplement. Okay, so all the pregnant women, they must take the folic acid and iron supplement. So that's why she's on folic acid and iron as well. Okay, she takes 1 tablet of folic acid and 1 tablet of iron supplement. Okay, and also she's on vitamin D capsules. Okay, so she's on cholecalciferol, that is vitamin D, 25 micrograms, so 1 capsule every day. Okay, so these are her current medications. So here, methyldopa, folic acid, iron supplement, and cholecalciferol, that is vitamin D. So these are her current medications. Now, let's have a look through what are the important findings from this scenario. So the main symptom, her current problem is uncontrolled blood pressure. Okay, so she has the uncontrolled blood pressure issue. Okay, that's the main problem here. Okay, and when we look at her medical history, she's pregnant and she has the hypertension problem. Okay, so these are the two main issues. So she's pregnant and she has the hypertension and no other medical condition. So what are her current medications? Okay. So the main medication is methyldopa. So she takes 250 milligram tablet twice daily. Okay. And the other medications are iron supplement and vitamin D supplement, okay, and folic acid. So these are just the supplements that she take every day. Okay, so these are the ones that she is on. Okay, and then and yeah, she's physically fit, so she doesn't have any other problems. So the only concern is her blood pressure. Okay, so she has the uncontrolled blood pressure, for which the doctors, they started her on methyldopa. Okay, and now after starting methyldopa, she started developing, like, her Coombs test is positive, which means that she's highly prone for hemolytic anemia. Okay, so now let's have a quick background about what is the significance of controlling blood pressure in a pregnant woman. Okay, so let's have a look through why this blood pressure control is important in pregnant women. Okay, so for every patient, controlling blood pressure is important. So if they have the hypertension problem, then they will develop a lot of other complications. Okay, due to hypertension, they will develop the renal impairment issues as well as the optical problems and all the other complications that will arise due to uncontrolled blood pressure. Okay. And that too, specifically in pregnant lady, if the blood pressure is not well controlled, then they will develop a lot of issues. Okay, so one of the major problem here is eclampsia. Okay, so if the blood pressure is not well controlled, then they will end up with a condition that is known as the eclampsia. Okay, eclampsia is nothing but they will end up with seizures. Okay, so if the blood pressure is not well controlled, when they have the high blood pressure during pregnancy, means they are pre-eclamptic phase. Okay, the pregnant woman is at the pre-eclamptic phase. Okay, so pregnancy with hypertension is known as a pre-eclampsia. And if hypertension is not well controlled, okay, she might end up with eclampsia at any time. Okay, eclampsia means nothing but she will end up with the seizures, epileptic attacks, epileptic seizures. Okay, so if the mother, if she gets the seizures, then it is dangerous to both mother and as well as to the baby inside. Okay, so which is a highly dangerous condition. So that's why they should never enter into the eclamptic phase. That's why blood pressure control, blood pressure maintenance is highly important during pregnancy. Okay, so now let's have a look through what are the important drugs that are available to treat the blood pressure during pregnancy. Okay, so now you might have understood the concept. Okay, so blood pressure management is highly important during pregnancy. In pregnancy, if the blood pressure is not well controlled, then they will end up with eclamptic phase. Eclampsia means nothing but they will end up with the seizures, and if they develop the seizure, if the mother develops the seizure, then it is harm to both the mother as well as to the baby. Okay, so let's have a look through what are the medications that are available, okay, to treat this hypertension problem during pregnancy. Okay, so there are four main medications that are available to treat the blood pressure issues, the oral tablets. The first one is methyldopa. Always, methyldopa is considered as the first line drug. In pregnancy, always will start with the methyldopa. And what is methyldopa? Methyldopa is a centrally acting alpha 2 agonist. It's a centrally acting alpha 2 agonist, which means that it won't act peripherally. It won't show the action on the blood vessels. It won't show the action on the heart. There are some medications that show the action on the blood vessels. For example, if you take the alpha blockers, they show the action on the blood vessels. They relax the blood vessels. As a result, they reduce the hypertension, blood pressure. Beta blockers, if you take the beta blockers, they show the action on the heart. They reduce the heart rate. Okay, when the heart rate is reduced, then the blood pressure will get reduced. So most of the drugs, they show the action either on the blood vessels, okay, relaxing the blood vessels, or by controlling the heart rate. But methyldopa is a centrally acting alpha 2 agonist, means it mainly decreases the release of noradrenaline. Okay, so in centrally in the brain and as well as in the peripheral nervous system. So it mainly decreases the release of noradrenaline. So that's the mechanism of action of methyldopa. Okay, and always methyldopa is considered as the safest drug in pregnancy. Means the first line drug is methyldopa. Okay, so if a pregnant woman, if she has a hypertension problem, then the doctors, they will start methyldopa. But one of the main problems with this methyldopa is the patient, they may end up with a hemolytic anemia. Means their RBC cells will undergo death. The RBC cells will undergo lysis. Okay, so that's the main issue with the methyldopa. Okay, that's why we perform the Coombs test. If Coombs test turns positive, means they are highly prone for hemolytic anemia. Then the other drugs that are available are Labetalol, which is an oral tablet as well. So Labetalol is an alpha and sorry, someone's mic is on. Labetalol is an alpha and beta blocker. Okay, so it has both the alpha and beta blocking property, means it relaxes the blood vessels as well as it also controls the heart rate. Okay, and oral tablets of Labetalol, they're also considered as one of the drugs of choice for maintaining the hypertension in pregnancy. Then the third one, sorry, admin team, can you make sure that everyone's mic is off? Then the next drug is Nifedipine. So Nifedipine is a calcium channel blocker. Okay, so it is a dihydropyridine calcium channel blocker. Okay, so this Nifedipine, sorry guys, someone's mic is on. Can you please make sure that you turn off your microphone? iPhone, the one with iPhone, can you please turn off your microphone? Okay, the next drug is Nifedipine. So what is Nifedipine? Amlodipine, Nifedipine, nicardipine, felodipine, all these are dihydropyridine calcium channel blockers. Okay, so these are the calcium channel blockers. And this Nifedipine, the controlled release, it is available in two different forms. One is the immediate release and the controlled release. The controlled release form of Nifedipine can also be used in pregnancy to control the blood pressure. And the last option is hydralazine. Okay, so hydralazine oral tablets are available. Okay, as well as the IV form is available. Okay, so in the next slide, upcoming slide, I will show you okay about all these medications. Okay, so we can also use the hydralazine. So especially the IV form of the hydralazine that we use in case of emergencies. Okay, so hypertensive emergencies in pregnancy. But again, for hypertensive emergencies in pregnancy, we go with the IV Labetalol. So these are the treatment options that are available. The oral tablets, when it comes to the oral tablet, the three main oral tablets that we use okay, to control the blood pressure during pregnancy are, so the first drug is methyldopa. Okay, so methyldopa is always considered as the first line drug. Okay, so pregnant women with hypertension means the doctors, they will start methyldopa. Okay, but if methyldopa, if they develop the positive Coombs test, then we have to think about alternate options. What are the alternate options that are available? The alternate options are Nifedipine tablet. Okay, so Nifedipine is considered as the second line option. Okay, so it is a second line drug in pregnant women. If methyldopa is contraindicated, if Coombs test turns positive, means methyldopa is contraindicated. There we have to switch over to Nifedipine, okay, which is a second line option. Then what is the third line drug? Third line drug is Labetalol, oral tablets of Labetalol. Okay, so this Labetalol is the third line option, which is used to treat blood pressure problem in pregnancy. Okay, so always start with methyldopa. If Coombs test turns positive, then think about the other alternate options. So what are the other alternate options? One is the Nifedipine and the third one is Labetalol. So these three are the oral tablets. Oral tablets means every day they have to take this medication. Okay, regularly they will keep on taking this medication throughout the pregnancy to control the blood pressure. Then assume that if a pregnant woman, okay, if she is taking methyldopa, okay, but her blood pressure is not controlled and all of a sudden her systolic blood pressure, it went up to 190, it has crossed 180 and it went up to 190. okay, which is an highly emergency condition where immediately they will admit in the emergency ward, okay, in the ED, then they will give the treatment to that lady. Okay. So why we have to give the treatment? Why we have to reduce the blood pressure immediately? What happens in case if we don't reduce the blood pressure immediately? If we don't reduce the blood pressure, then she will end up with eclampsia phase. Eclampsia means seizures. She will develop the seizures. So that's why we have to reduce the blood pressure immediately. How we will reduce in emergency? Do we give these oral tablets like methyldopa or nifedipine or labetalol? Do we give the oral tablets? No, we never go with the oral tablets. In emergency situation, we go with the IV drug, intravenous drug. So what are the intravenous drugs which are considered as first line in pregnant women who develops the emergency, hypertensive emergency? Okay. So here, Labetalol, again, Labetalol IV, intravenous Labetalol is the first line drug. Okay, so assume that a pregnant woman, all of a sudden her blood pressure went up to 180 and she is in emergency ward in the hospital. Okay, so now which drug that we have to give? Immediately we have to give the Labetalol, IV Labetalol to control her blood pressure. If labetalol is not available or if labetalol is contraindicated, okay, so the best example that I can tell you for the contraindication of labetalol is asthma. If she has severe uncontrolled asthma or shortness of breath issues, because labetalol is both alpha plus beta blocker. It blocks the alpha receptors and also it is a non-selective beta blocker. It blocks both the beta 1 and beta 2 receptors. These beta 2 receptors are mainly located on the respiratory tract, and if these beta 2 receptors they get blocked up, then shortness of breath will occur. Okay. So in case if there is any contraindication to labetalol, then what is the other alternate? That is the IV intravenous hydralazine. Intravenous hydralazine, IV hydralazine is considered as the second line option. Okay. So these are the medications that we use to treat the blood pressure problem in pregnant women. Okay. So what is eclampsia? What is meant by pre-eclampsia? Pre-eclampsia means already they have the high blood pressure problem. Okay. And during this pre-eclampsia, if we don't control the blood pressure, they will end up with eclampsia phase. Eclampsia means seizures. If the seizures, if the seizures they start, okay, then it leads to cause the death of the fetus as well as the mother. Okay, so that's why they should never enter into the eclamptic phase. Okay, so that's why we have to learn about all these medications, which helps to prevent the eclampsia condition. Okay, so what is the first line drug the pregnant woman must take regularly to control her blood pressure? Methyldopa. But what is the main challenge with this methyldopa? So if Coombs test turns positive, then we can't continue methyldopa. Why? Because if she keep on taking the methyldopa tablet, then she will end up with hemolytic anemia. Okay. So if Coombs test turns positive, then we have to think about the alternate option. So here, what is the alternate option? Nifedipine, second line. Okay. So, and the third line is labetalol. So we can go with the nifedipine, then also we can use the labetalol. So these three are the oral tablets that they can take during pregnancy to control the blood pressure. And what about in case if the same pregnant woman, if she gets severe hypertension problem, that is systolic blood pressure, it went up to 180 and above and got admitted in the emergency. Now, how do we treat? So at first we have to give the IV labetalol. Okay. If IV labetalol is contraindicated, then IV hydralazine can be tried. Okay. So these are the medications that we use to treat the blood pressure problems in pregnant women. Now, with methyldopa, it is considered as one of the first line drugs, but there is one more challenge with this methyldopa. Okay. So what is the main challenge with the methyldopa? One is with methyldopa, positive Coombs test means hemolytic anemia. That is one of the major side effects. And then the other problem with methyldopa is those who take the methyldopa, they might end up with severe risk of depressions. Okay, they may end up with severe risk of depressions. Why? Why depression? Because what is the main reason for depression? The main reason for the depression is decrease in the amine levels in our brain. Okay, the main reason for depression is decrease in the amine levels in our brain. Which amine? Noradrenaline and serotonin levels. If noradrenaline levels gets reduced in the brain, at the synapse, at the junctions. If noradrenaline levels gets reduced, then we start developing depression. Or if serotonin levels gets reduced, then also we'll start developing the depression. Okay. Then what is the mechanism of action of this methyldopa? So methyldopa is a centrally acting drug. Okay, it is a centrally acting alpha-2 agonist. Okay, so which means that methyldopa always it tries to decrease the release of noradrenaline. Methyldopa, it tries to decrease the release of noradrenaline. That is how methyldopa tries to control the blood pressure. Okay, methyldopa controls the blood pressure by decreasing the release of noradrenaline. And what happens in depressive patient? Already they have the depression, suffering with depression. Okay, and if they take the methyldopa, then what will happen to the depression condition? Okay, what will happen to the depression condition? Already they have the depression problem. Okay, and on top of that, if they take the methyldopa will decrease the release of noradrenaline at the synapse. It will further decrease the amount of noradrenaline. Okay, so which means that they will end up with severe depression issues. Okay, so that's why one of the main contraindications for methyldopa is, okay, so one of the main contraindications for methyldopa is, in case if the patient has depression problems, then they should never take the methyldopa. Okay, and there is one more drug, clonidine. Clonidine is also another centrally acting drug. Even for clonidine, the same contraindication. Both the methyldopa and clonidine, they are centrally acting antihypertensive drugs. Means they try to decrease the release of noradrenaline. Okay, and both the drugs are contraindicated in patients those who have the depression symptoms. Okay, and patients those who take the methyldopa clonidine for a long term, they might end up with depression issues. Okay, so these are all the things that we need to know about management of hypertension during pregnancy. Okay, so well guys, what is our case here? The main problem in our case is, okay, so she's a pregnant woman and she developed the hypertension problem, for which the doctor, they started her on methyldopa, and after starting the methyldopa she turned positive for the Coombs test. Means we can't continue methyldopa. Okay, so now here is a scenario and the question for you. Okay, so the scenario that already we have gone through this scenario. Okay, now the question is, you have to recommend an appropriate alternate oral antihypertensive drug for her. You have to recommend an alternate antihypertensive drug for her. So which drug do you recommend? You can give your answer in the chat box. Do you recommend Nifedipine? Do you recommend hydralazine? Do you recommend prazosin, or do you recommend metoprolol? Yep, very good. So now we have to recommend Nifedipine tablets. Okay, so because after methyldopa, the next agent that we have to try is Nifedipine. Okay, so Nifedipine is always considered as the second line option. Okay, after methyldopa, the next drug is Nifedipine. Okay, so which is a second line option that we can give in pregnancy. So we don't give prazosin oral tablets. Okay, during pregnancy we don't use metoprolol, and also we don't use the hydralazine oral tablets during pregnancy. Here 25 milligram hydralazine is the oral tablet. Okay, so we don't use it in pregnancy to control the blood pressure. Then here is another question for you guys. If RR, that is our patient, has developed uncontrolled blood pressure problem, that is hypertensive emergency. Okay, so if the lady has developed a hypertensive emergency where her blood pressure, it has went up to 180 mm of mercury, the systolic, it went up to 180 mm of mercury. Okay, now which antihypertensive drug can be considered as a first line option? Intravenous sodium nitroprusside, or intravenous labetalol, intravenous hydralazine, or prazosin tablet? So which drug do you consider it as a first line agent? Okay, very good guys. Okay, so that is IV labetalol. So labetalol is considered as the first line drug to treat hypertensive emergencies during pregnancy. Okay, then one more last question for you. Among the following, which medication is contraindicated in patients with a history of depression problem? Okay, so there are 4 antihypertensive drugs. which antihypertensive drug is contraindicated in patients those who have a history of depression issues? Amlodipine, prazosin, methyldopa, or nifedipine? Very good. Methyldopa. So methyldopa and clonidine. So they both are centrally acting antihypertensives, and these centrally acting antihypertensives are contraindicated in patients those who have the history of depressions. Okay. So final conclusion. So what we have learned in today's session. Okay. So in case of pregnancy, how do we manage the blood pressure? So in pregnancy, always methyldopa is the first line drug. But with methyldopa, if we perform the Coombs test and if that Coombs test turns positive, then we can't continue the methyldopa because the patient will end up with hemolytic anemia. Okay, so that's why we have to think about the alternate options like nifedipine or labetalol oral tablets. And if the same pregnant woman, if she gets hypertensive emergencies, okay, and if she get admitted in the hospital, then what is the first line drug? The first line drug in hypertensive emergencies in pregnant women is labetalol, IV labetalol. If IV labetalol is contraindicated, then we can think about IV intravenous hydralazine. Okay. And what is another drawback with the methyldopa? One more drawback with the methyldopa is methyldopa will increase the risk of depression problems. Okay, so these are the few things that in a simple way that we have learned from this case study, guys. Okay, so this is how that they will ask the questions in any licensing examination, not only in OPRA. Okay, so but for any Western country licensing examination that you are preparing, so you have to prepare in such a way in a case study based scenario so that you will remember it forever. Okay.